Are you looking for a birth control that doesn't have any side effects, is inexpensive, and helps you understand your body cycle? Well, look no further because the fertility awareness method helps you do just that. The fertility awareness-based methods are ways to track ovulation, the release of an egg, in order to prevent pregnancy. Some people call AFMs natural family planning. It is most reliable for women with regular menstrual cycles. This method becomes more effective as a woman becomes more familiar with the signs of ovulation and the pattern of her menstrual cycle. The most common methods are the calendar rhythm method, the basal body temperature method, the cervical mucus method, and the symptothermal method, which combines the latter two. The calendar rhythm method is a kept record of a woman's menstrual cycle that tracks fertile and infertile days. You can determine your expected fertile period by charting your menstrual cycle for a minimum of 8 months to determine the longest and shortest menstrual cycles. It may not be practical or safe for women with irregular cycles. Regular cycles are never shorter than 26 days nor longer than 32 days. You can use a calendar or cycle beads to help keep track. These are two examples of the calendar rhythm method. On the left you see a calendar that can only be calculated after you, for a minimum of 8 months, have calculated your longest and shortest cycles. On the right you see cyclobeads. The red bead indicates the first day of your period. As you move the movable rubber ring for each day, as you can see, the white beads indicate that pregnancy is most likely. These would be marked as unsafe days. The brown beads are labeled pregnancy is very unlikely. These are safe days. The basal body temperature method is a kept record of a woman's morning temperatures that determine ovulation. Your body temperature is lower during the first part of your cycle. It usually rises slightly after ovulation. Your body stays elevated for the rest of your cycle and falls again just before your next period. The BBT is a temperature of the body when it is completely at rest. It varies from person to person. You will be most fertile during the 2 to 3 days before your temperature rises. Before ovulation, normal temperature for most women is 96 to 98 degrees Fahrenheit, and after ovulation, the normal temperature for most women is 97 to 99 degrees Fahrenheit. The cervical mucus method is when ovulation predictions relies on the vigilant observation of secretions from the cervix. Changes in the quality and quantity just before and during ovulation are charted onto a calendar. This is an example of a mucus pattern. So, are these methods effective? The typical failure rate overall is 25%. The perfect use failure rate overall is 2 to 3%. But the fact still remains, there are negative and positive side effects and advantages and disadvantages. Some advantages and positive side effects include a greater involvement and communication between partners to avoid pregnancy. This meets religious guidelines of birth control. There is no need for prescriptions. Calendars, thermometers, and charts are easy to acquire, and there is an increased awareness of how to become pregnant if concerned. Some disadvantages and negative side effects of these methods are high failure rate if not used consistently or correctly, fewer safe days to have intercourse each month, training is essential, breastfeeding, illness, and other factors can obscure fertility, there is no protection of STIs, and if periods are not regular, these methods may not be effective. Last but not least, if you feel this method best suits you, these are ways to obtain these methods. As stated, the cost is relatively inexpensive. Cyclobeads and thermometers range from $10 to $15 at local drugstores and grocery stores. Fertility awareness apps can be downloaded for free on Androids and Apples. Also, there is ovulation predictor kits that also can be picked up at your local drugstore. There are urine, saliva-based, and computerized electronic monitoring devices. These are my references. Thank you for watching.